Good evening, everyone. There seems to be a technical glitch.
Hello, Rashmi.
Hello, doctor.
Hello, doctor. There seems to be some
Yeah,
technical glitch.
yeah, some technical glitch.
Okay,
So,
fine. Yeah.
so good evening, everyone. I'm Rashmi Gopal, and I'm an integrative nutrition health coach. And Dr. Anupama is here. She is an Ayurvedic fertility specialist with over 25 years of experience, and she's the co-founder of Shrestha Ayurvedic Center in Kormangla. And I've been collaborating with her and getting mentored from her um, on various, we work together with fertility patients and women with many hormonal issues, especially PCOS. Today is, part two of our PCOS series. And last week we actually discussed the diagnosis and what is PCOS, is it really curable, understanding in depth about PCOS, and also identifying the type of PCOS and many more things. So I'm continuing with that. I would request Dr. Anupama to start with little insight on PCOS.
Yes. So last time when we discussed, we started with a very basic understanding of PCOS, more than basic, a very simple understanding, because there is so much over information out there and it can be very scary and intimidating. Also, a lot of misinformation also. So we discussed the difference between PCOS and PCOD and the prognosis of it, the types of it, and the signs and symptoms of it. If anybody has missed that, they can check out the part one on our page. And so when we come to the approach, I mean, once we have diagnosed it, we have a certain idea about what kind of PCOS it is and many other fundamental signs and symptoms of the patient. We start the approach. My approach is always same, whether it is any kind of PCOS. It may be androgen excess, it may be high serum insulin, it may be bulky ovaries, it may be obesity or lean PCOS. In all the cases, my approach always starts with gut health. So once there is acceptance in a patient that yes, I have this and I have to start looking at it in a holistic way. I also see a lot of patients reaching out, proteins and immediately start gymming or immediately start herbs to regularize their period. But my approach is always, my advice has always been to look at their gut health first. That is how your protein will get assimilated, that is how your herbs will get digested, that is how your liver will be capable of throwing out the excess estrogen or harmonizing your hormones. All of it starts from your gut health. Sometimes I also see a lot of frustration from these patients that they are not starting a PCOS treatment right away. Trust me, that is the PCOS treatment. That is where it all starts. And if they are unsure if they have any gut health issues, they can look at very basic things like, do they have a good appetite, or are they eating just because it is time, or do they feel light after a few hours, and do they have natural hunger? Do they think their digestion is good, or are there some kinds of food they are not able to digest, and do they start getting bloating by the end of the day, or do they have acid reflux? Are there some types of food they cannot digest at all, let's say fatty foods, even if they are good fats? and of course the constipation part, and also some of them have IBS, sometimes having constipation, sometimes having loosies, and all this, any kind of disturbances. If you have any of these, you should look at your gut health. At the bottom of it, PCOS is an inflammatory disorder, all kinds of PCOS. So the inflammation has to be reduced, and the best way to start working on it is from your gut. So when we work together, when I do the basic analysis and send the patient to you, that is what we always discuss. How are we going to approach this patient? How are we going to start gut health improvement for this patient? That's how we do it. And I'll hand it over to you. Like I hand over my patients to you, and you can share a little bit about how you start the approach after we have the initial discussion and the Prakriti analysis, the body type analysis. Based on that, how do you start, and what all do you include in your gut health program, the gut reset program you do?
Sure, thank you, doctor. Actually, as you hand over the patients to me, like you mentioned, and I also get insights about their prakriti or the body type, and some more insights about their health history. I start my work based on that, because it's very very customized on their prakriti and their body type as well, and their already existing conditions of gut health. Many times it's um, there and it's clearly visible. So I start my gut health reset program by first with a detox diet for a few days, maybe 21 days or 45 days, depending upon their current condition. So also start with some elimination of certain foods, and then including some simple, easy to digest foods. And then before that, I also go deeply into their current routine, what shifts do they work in, what is their sleep routine, how is their circadian rhythm going, what are their food timings, what are their cuisines, culture, and what kind of a relationship do they have with food and lifestyle. So a lot of times it's also lack of awareness and acceptance, like we discussed last session. That so I analyze the mindset that they are carrying right now, and then I think a lot of time just goes into understanding that person's background, health history, and the insights given by you. There is a clear understanding of where they stand currently. So that's where we begin working with that person. And then slowly I also educate them on simple sustainable steps that is practically possible to start with. And then it's always very very different with different people. So however it starts with a detox gut reset, but then how they cook and what ideas to use, and how to use probably time saver practical strategies, and many more things that I provide guidance with, from helping them understand different recipes, different cooking methods, easier, faster ways to include, you know, uh, good, healthy home cooking, and then understand maybe simple things like not eating outside food for some time. Also avoiding, identifying environmental toxins like xenoestrogens, probably in their either in their the things that they use on themselves, or the utensils that they are using, or the oils that they are using. So there are many toxins also which enter our body, which acts like an endocrine disruptor, comes in the way of hormones. So a lot of times just simple things like this starts to rectify their hormones and starts to bring some balance, and that starts with some motivation for the other person also to continue the journey with as simple steps as that. But gut reset is truly powerful, because as you mentioned, that's where, absorption of nutrients and absorption of protein, and then, liver health improves, and then, detoxifying many things also starts. So this is a starting point. I also help people on how to read labels, give sources on where to shop healthy, and um, what else? Provide recipes, ideas, many things, which actually could be a roadblock in their journey. And sometimes they're very small, but they are a big hindrance to their health journey. So that's where I start off from. And then also very important aspect of what I concentrate also are mind body connection, and how is their stress management, are they able to manage, because stress plays a huge role in PCOS, because it's a clearly a hormone, and as you mentioned HPA, it's like hypothalamus pituitary and adrenal, it's all connected. So stress and sleep has a huge role in managing PCOS. So we'll go more in detail about the mind management, emotions, and sleep and lifestyle related things in our next session. But talking about gut health, even for gut reset, this aspect of stress and sleep also plays a very huge role, which simultaneously I start working on. And of course, we also guide people on intermittent fasting, because people ask if they can start with
Can see a
intermittent.
question from one of our a question here. What's your opinion about intermittent fasting or for PCOS? I can read. I find the question here, and this is the most common question I am asked. So just like anything else, it does not have a yes or no question answer. Unfortunately, I am not against intermittent fasting, and I do believe that 2 meals are enough for most of us. I don't think we do enough physical work. We spend so many calories with the kind of jobs we do, which are mostly desk jobs nowadays. So I do think that 3 meals are probably not necessary, and 2 meals may be all right for most of us as long as they are nutritionally balanced. But I don't have. I cannot suggest intermittent fasting for everybody for the reason that we do not know about their gut health. Number one, it comes back to that. In case, and it is not something you should start one day randomly because you read on Instagram or you read somewhere, you saw a study where they said intermittent fasting works for hyperinsulinemia, which is very common in PCOS, and you start from next day. Don't do that. Start very slowly, identify what are the problems with your gut health, rectify them. For example, if you start intermittent fasting and you end up having acid reflux, bloating, headaches, sleep issues, all of this, then you know that your body is yet not ready for intermittent fasting. We have guided so many PCOS patients for intermittent fasting, and when we look back, we understand that none of the advices were same for everyone. And sometimes what the patient felt gave us a idea, gave us a direction to help them further. Okay, and I have also so what happen? I also see many patients eating very small meals because multiple small meals throughout the day to maybe for acid reflux or a GERD or an acidity condition, and then they stop one day and then they start doing intermittent fasting. Okay, so that can really throw off the acid balance in your body. We call it, Pitta Vriddhi Lakshanas, and we can see that all over. So, sometimes it may even need a Virechana or a deep detox to start something like that, and has to be started slowly. There is a certain way of doing it. Yes, it can be very beneficial for some kinds of PCOS, but it has to be done under guidance.
Thank you, doctor. Actually, this is one perspective that I learned from you, and after that, it has really changed my work with people with PCOS, because it's so important to understand their gut health and then recommend intermittent fasting accordingly. So, yeah, few things to um, generally take care are, 30 to 40 ml per kg weight, or of water consumption every day. So if we can time it and drink water throughout the day and not at one time, and hydration is very important in hormonal balance. And then having an early dinner at least by 8 o'clock, 8 p.m., and then not having a longer gap between dinner and sleep time, which means
Yeah.
try and sleep early as well. So not more
Yeah.
than 2 to 2.5 hours.
Oh, that's a
So
very,
that
very important, very significant point you mentioned, because most of us are subscribing to the early dinner. I have patients who eat as early as 6:30 because sunrise, sunset, and all that they are following. But what we are not following is that people, when they were following sunset and sunrise, they did not have electricity probably, and they slept early. So if we are selectively, doing one thing and not the other, then there is no balance. And we should also remember that a lot of hormone repair happens in the first part of the night, because that is how our circadian rhythm is already set during our childhood. So between 10 p.m. to 2 a.m. a lot of hormone repair happens because the body is used to it. Okay, and if we are awake and also looking into a blue light like our devices, the body is very confused whether it is night or daytime and what kind of activity it has to do. And also when there is light, if it considers it as daytime, so the metabolism will be faster, you will digest faster because you would have also eaten early. And then at that around 2 p.m., you may have acidic symptoms. I see a lot of patients who have this acidic symptoms between 1 a.m. to 1 a.m. to 4 a.m. in the morning. Okay, so that could be another reason. Okay, but there's a long gap between the dinner time and the sleep. That is possible. Many times we see so many good results with very, very small changes we make. The cumulative effect can be huge. Even weight loss happens just by correcting sleep. Many times, even if they have not started on the gym or they have not started fasting, nothing of it, but just with sleep also we see that. So I think it should be a cumulative effect of small habits done consistently. I think that is what will give us results.
absolutely, definitely. As recently as we saw somebody that we were working with PCOS and with oral contraceptive pills to get periods, and just with simple changes like this that we talked about, within 2 to 3 months she was able to start getting her period cycles back, and many other symptoms in really addressed. So it's so magically it works, simple things like this, and addressed very in a very customized way with support. Of course everybody needs support. So
Yeah.
it's an exact it's a very satisfying work to see different things working on different people with simple
Yes.
changes.
Yeah. You should never forget we are all bio individuals and we need our own set of things for us for things to fall in place for all of us. I think we are just the kickstart for an inner journey like that. Once you know how to connect with your body itself will give you so many cues. You understand, and at some point you arrive at this plan which works for you. I think that is a long term benefit. It's not any herb or any kind of magic pill which can do that. It's only that inner journey. The medicines, all of it are to handhold you in the beginning, but in the longer run you understand your body, you respect your body, you listen to your body, and not just any kind of fad thing on the internet. If it works, even if it is a superfood, it does not work for you, it is not a superfood for you. I get a lot of questions about even women in 20s asking me whether they should start collagen, they should start protein, should they start, so many questions about it. So again, my answer is always start with your gut health, and then your body will tell you what it needs. you know Simplicity is the key. You know, that simplicity, that direction is always given by your own body. I think you and I, what the kind of work we do is just starting them off on their journey of exploring, discovering their own health, and I think they can take over. And we see so many patients managing without any medicines, and some of the patients who took help for their first pregnancy, getting pregnant without even any medication in the second pregnancy. I think there is no bigger evidence than that.
True. Yes, thank you for your insights, doctor. And I think next week we'll discuss the part three of it, and we'll dig deep into other aspects, and we'll hear more from you uh, on how to go about it, also, doctor. So we look forward to our next session, and
Thank you.
thank you so much.
Good night.